I grew up in Zambia, in the southern province. I think 86. I remember I was riding on a bus, and there was an article in the newspaper that was talking about a new disease in the US, and it was affecting gay people. And I remember reading and thinking, how strange and how far away. I lost family members, I've lost friends, classmates, fellow workers, like people that we worked with in the hospital. And that's not like, when you're graduating from college, when we're all leaving, we're all excited, we're going to go out and make a difference in the world. That's not what we expected. We're thinking, get married and have, get your house and have your kids and go for holidays. But HIV/AIDS changed all that. From college, actually, like my graduating class, we were maybe 12 social workers that did the bachelor's, our group. And of those 12, I think I've definitely lost maybe 5. When, the HIV epidemic happened and people in our hospital were diagnosed as HIV positive, I was part of the team that was charged to come up with a response. Like, what are we going to do as a hospital, because the projections were so bad. And I remember going out to do home-based care, and one time I had, let's say, 7, 8 patients that I needed to see, and 3 or 4 of them had died between the last visit I made. I imagine that if we had the aggression of PEPFAR and the putting of the resources, that money that has been pumped into the response, both to support prevention, care, and now ART, if we had had that maybe even 10 years or like in the 80s, I don't think the epidemic would have gone to the proportions that it did. So, what took you guys so long? And in that, I think I'm also acknowledging that PEPFAR has really made a difference for life and death. So there's a sense of hope, there's relief. I mean, the reduction in the number of funerals. And now to have not gone for a funeral for like maybe 2-3 years, as a family, it makes a world of a difference, whereas we have time to celebrate life. I really believe that the answer lies with communities. And I think even with all the breakthroughs, clinical breakthroughs, like we're looking at, the drug trials, the vaccine. If we don't do our community work right, if we do not develop our pro-health norms in communities, if people do not take the medication, the breakthroughs will come to nothing. Because the taking of medication, whether it's prevention, also transmission, happens in communities, not in health facilities. So that's why I'm doing community engagement. I really believe in it. And even if EGPAF was not paying me as community engagement mobilization officer, I would still do community engagement.